Early signs of passive suicide ideation. Suicide is a very sensitive topic that most of us would like to avoid. This topic may conjure up images of Hollywood stars, family members, and friends who have taken their own lives. But suicide, active or passive ideation, is something that can hit close to home. Passive suicide ideation may cause a person to have fleeting thoughts of death or dying without taking concrete steps for self-harm and ending their lives. While mental health has become easier to talk about, passive suicide ideation often stays hidden in the shadows. It's a topic that a person with these thoughts may be afraid to bring up, yet it is something that we must understand and offer support for individuals suffering from the complexities of passive suicide ideation. In this video, we discuss what passive suicide ideation is, how it differs from active suicide ideation, the signs and symptoms to watch for, and more. Before we get started, subscribe, comment, and like this video to support our channel. What is passive suicide ideation? Many people are not familiar with this term, but it is defined as the contemplation of dying or holding a wish to die without actively working to end their life. Passive suicidal ideation is different from someone committing suicide. However, if this condition is not treated, it could lead to loss of life. In other words, passive suicidal ideation is the desire or thought of dying without creating a plan to end one's life. This form of suicidal ideation can take several forms. A person may feel or think the following: I hope someone crashes into my car. I want to die in my sleep. I should never have been born. They'd be better off without me. I can't live like this anymore. My life has no purpose. I want everything to stop. I don't want to be here anymore. These are only a few examples of the thoughts a person might have if they have passive suicidal ideation. They may also daydream about their death, which is another type of passive suicidal ideation. The main difference between this and active suicidal ideation is the need or desire to act on these thoughts or make plans to cause one's own death. While passive suicidal ideation doesn't always lead to suicide, the person who has these thoughts and feelings is at a higher risk of committing suicide. It's easy to cross over from passive to active suicidal ideation. The crossover may occur slowly or suddenly, but it can happen. For these reasons, passive suicidal ideation needs to be taken seriously and should not be ignored. What causes passive suicide ideation? Passive suicidal ideation can start from a variety of factors. It often involves complex interactions between psychological, social, and environmental influences. While each individual's experience is unique, some common underlying causes and contributing factors may include mental health conditions. Underlying mental health conditions such as depression, anxiety disorders, PTSD, post-traumatic stress disorder, bipolar disorder, and substance abuse can increase the risk of passive suicidal ideation. These conditions can lead to feelings of hopelessness, despair, and a distorted perception of reality. These thoughts and feelings can contribute to thoughts of death or dying. Trauma and stress. Past or ongoing trauma, such as physical or emotional abuse, neglect, or significant life stressors, such as the loss of a loved one, financial difficulties, or relationship problems, can overwhelm a person's coping mechanisms. The result can be an increase in vulnerability to passive suicidal ideation to escape the trauma and stress the person is experiencing. Chronic pain or illness. People living with chronic physical pain or debilitating illnesses may experience significant stress and reduced quality of life. These conditions can contribute to feelings of hopelessness and thoughts of death as a way to escape the pain and suffering. Social isolation and loneliness. Lack of social support, feelings of isolation, or a sense of disconnect from others can worsen feelings of despair and increase the risk of passive suicidal ideation. Lack of meaningful connections or a support system can cause individuals to feel overwhelmed and disconnected from life. Genetic and biological factors. Researchers believe there is also a genetic predisposition to mental health conditions associated with passive suicidal ideation. In addition, Imbalances in neurotransmitters or disruptions in brain chemistry can play a role in the development of depression and suicidal thoughts. Psychological factors. Negative thought patterns, low self-esteem, perfectionism, and the tendency to ruminate on problems or past traumas can contribute to feelings of hopelessness and increase the risk of passive suicidal ideation. Cultural and societal factors. Cultural attitudes toward mental health, suicide, and help-seeking behavior can influence an individual's willingness to seek support. The stigma surrounding mental illness may prevent an individual from openly discussing their struggles or seeking professional help, worsening feelings of isolation and despair. This is not an exhaustive list of causes. There are many reasons why a person may experience suicidal thoughts. These thoughts can affect anyone at any time of life. There is no tie between a person's age, gender, race, or socioeconomic status. What is clear is that many people who have passive suicidal ideation choose to keep these thoughts to themselves and suffer alone. It's important to understand that passive suicidal ideation is not a choice or a sign of weakness. Instead, this condition is a symptom of underlying distress. The person experiencing these feelings deserves understanding, support, and appropriate help. If you or someone you know is experiencing passive suicidal ideation, it's essential to seek help from a mental health professional or counselor for assessment and support. How to recognize signs of passive suicide ideation in others. It can be challenging to recognize the signs of passive suicidal ideation in others, especially in those who do not openly express their feelings and thoughts. However, there are some signs and behaviors that may indicate a person is experiencing passive suicidal ideation. Changes in mood. The person may become withdrawn, irritable, or unusually quiet. Their mood may seem to be depressed or flat. Expressions of hopelessness. The individual may make statements that convey a sense of hopelessness, despair, or a belief that things will never get better. They may express feelings of being trapped or burdened by life and/or circumstances. Talk of death or dying. The person may frequently speak about death or dying. They may express a desire not to wake up in the morning. They may also make statements indicating a sense of resignation or acceptance of their fate. Social withdrawal. An individual may withdraw from social interactions with family and friends, isolate themselves, or decline invitations to social events. Neglect of personal hygiene or appearance. A person with passive suicidal ideation may not take care of themselves. They may neglect their personal hygiene, stop grooming themselves, or lose interest in their appearance. Engagement in risky behaviors. A person may engage in risky behaviors or put themselves in dangerous situations without regard for their safety. This can include reckless driving, substance abuse, drugs, alcohol, or self-destructive behavior. Loss of interest in activities. An individual may lose interest in activities or hobbies they once enjoyed. They may withdraw from previously enjoyable activities and express a lack of motivation or enthusiasm. Giving away possessions. A person who has passive suicidal ideation may give away cherished belongings or make arrangements for their possessions as if preparing for a departure. Sudden improvement in mood. A person may suddenly improve in their mood or demeanor. This sudden change may indicate they have made a decision to end their life, and they feel a sense of relief or resolution. If you notice any of these signs or behaviors in someone you know, it's imperative to take their concerns seriously and offer support. Encourage them to talk openly about their feelings and experiences. Assist them in finding help from a mental health professional or counselor. If there is an immediate risk of harm to themselves or others, do not hesitate to contact emergency services or accompany them to the nearest emergency room for evaluation and support. Concluding thoughts. Passive suicidal ideation is a nuanced yet significant aspect of mental health that often goes unnoticed. However, this condition warrants our attention and understanding. While it may not always be apparent in outward behaviors or explicit statements, the presence of passive suicidal ideation can indicate a deep emotional distress and an increased risk of more severe suicidal thoughts and behaviors. Recognizing the signs of passive suicidal ideation in others requires attentiveness, empathy, and a willingness to have open, honest conversations about mental health. If you or someone you know is experiencing this condition, it's essential to take it seriously and seek help from a mental health professional or counselor. With understanding, compassion, and the appropriate intervention, we can navigate the challenges of mental health together and work toward healing and recovery.